the Omicron variant of the virus. Today, I'm happy to announce that St. Louis County has received this powerful new booster vaccine from the state and is set to begin accepting appointments this afternoon. Appointments are available at two locations, the John C. Murphy Health Center in Berkeley and the South County Health Center in Sunset Hills. The hours are from 1 to 4:30 in the afternoon, Monday through Friday. You may make appointments by clicking on the COVID-19 Vaccines tab on the county's website. The web address is stlewiscountymo.gov. We're asking residents to make appointments because we anticipate a surge of interest in the new shots and we want to be able to accommodate everyone. The updated COVID-19 boosters, which are known as bivalent boosters, are specifically designed to fight the Omicron BA.4 and BA.5 variants, the most transmissible versions of the virus and the most common version in St. Louis County. When the original vaccine and booster shots were created, these new variants didn't exist. The new boosters add a powerful weapon to the fight against the spread of COVID-19, and we strongly encourage everyone who is eligible to get one. There are two brands of the new bivalent booster: Pfizer, which is approved for ages 12 and older, and Moderna, which is approved for those 18 and older. Both are available through the two county vaccination centers. While neither of the two versions has been approved for children younger than 12, we still offer the original booster shot for those under 12. In the coming weeks, the CDC is expected to recommend updated COVID-19 boosters for other pediatric groups. Another important restriction to keep in mind is you can't get the new booster until you've gotten the initial COVID-19 vaccine. That means either 2 doses of Pfizer or 2 doses of Moderna or a single dose of Johnson & Johnson. You do not need an appointment to get your initial dose, so please come to one of our health centers to get that taken care of. And then we can schedule your booster dose at that time. Also, you cannot get the new booster until it's been at least 2 months since you've received your last COVID shot. COVID's not in the news as much as it was in the better part of the past 2 years when it held a tight grip on our community and sent thousands to the hospital and took the lives of 3,495 of our county residents. Thankfully, we now have vaccines and our hospitals have the experience and treatments in place to keep the virus from filling up our ICUs. But it's still very present in our community and people are still getting sick and staying home from work and school. St. Louis County is documenting more than 200 cases each day of COVID-19, which puts us in the CDC's category of high transmission. And we know those are only the cases we know about. While we encourage individuals to use the at-home antigen test and report that to the county health department, it's not a requirement. And because of that, the real number of new cases in our community is even higher. We also know that cases tend to rise as temperatures fall, and the past 2 winters have brought with them surges of cases. Indoor gatherings, which are common in the fall and winter, lead to more transmission of COVID. For these reasons, we need to do all that we can to stop the spread of COVID, and that includes getting your new booster shot if you're eligible. Thanks, and I would be happy to answer any questions.
Is there any plan, or is the county health department prepared for a COVID/flu shot? People coming to get both of them, or is that something that would be better handled separately?
Yeah, the question is about the availability of the COVID and flu shot or a combination shot. I'm not aware of any combination shot, but I know that it's common to get a flu shot and a COVID shot at the same day, and we certainly can do that.
Is there anything that you all learned from the original vaccination push and then the booster push that better prepares us for this next round of vaccination?
That's a good question. The question is, what have we learned from past vaccination efforts? And I think we've learned that it takes an enormous amount of communication to get the word out that the vaccines are available. that we still have some pockets of hesitancy in receiving the vaccine, but that's less than it's been in the past. So we're working hard to address any concerns anyone has in the community about the value of the vaccine, the importance of the vaccine, and the importance of limiting the spread of COVID in our community. But I think our biggest lesson that we've learned in our community and across the country is that we just need more communication about the benefits of the vaccine, and we need to let everyone know when it's available and be as flexible as we can.
And this may be more of a question for the CDC, but I'll throw it out to you anyway. If this current vaccination targets this new specific strain, we haven't really seen many cases of the original strain that the original vaccination and the booster targeted. Why do we think we still need those two before getting the booster?
Yeah, so the question is about the immunity that develops from vaccinations and why we would need the original vaccine before we get the booster. And the booster is just that. It boosts the original immunity. And even though the original vaccine isn't designed specifically for these new variants, it's important to get that initial exposure in your immune system and get that initial immunity started before we move specifically to the booster that's designed for this variant. You know, I don't know, I couldn't tell you why the CDC has started with boosters instead of an original vaccine that covers all variants. It's just the way it's been designed, and it may have something to do that with 90% of our community has either been originally vaccinated or exposed to the virus. I can't explain the decision-making and the scientists when they develop that vaccine, but I do know that the original vaccine will help some with all versions of COVID and will help some from the new variants. But it's important to get this booster because it's specifically designed for the BA4 and BA5 variant.
If no one has any other COVID questions, I have other questions.
Any other COVID-related questions? Okay.
You now know who you'll be running against in November. Your initial reaction to that?
Well, I mean, it's election season, and there's going to be an election, and we're electing folks at all levels of local and state and federal government, and it's really not that remarkable that we have an election for county executive. This is, in a certain sense, a rematch, and I'm looking forward to the conversation about our visions for the community. And I'm certainly welcome and ready to discuss my record over the past 3 years. I think we've accomplished a great deal.
One of the things your opponent has criticized was that when the COVID epidemic happened, the pandemic happened, that you were solely focused on the reaction from the health department and didn't listen to other possibilities, let's say, i.e. the business community, about what might be best. Your reaction to that?
Yeah, so the question is about original health response from St. Louis County. You know, this is a political season, and I expect a lot of political criticism, especially looking back. It's always easier to Monday morning quarterback. But we followed the guidance from the Pandemic Task Force, from the Health Department, from the CDC. We took actions here in St. Louis County that and we saw similar decisions across the country in urban areas and in other states. And I think we made pretty good decisions. We balanced the response in the community. We had many different business advisory groups that were in constant daily and weekly contact with the health department and helped us adjust our policies to the real-world impact of those policies and helped us provide guidance to different business sectors who were desperately seeking guidance in a very difficult time in the history of our community and the history of our country.
He also mentioned that he believed that the race for the county executive should be nonpartisan. Do you feel as though that's just something that's being thrown out there because he switched parties, or your reaction to him switching parties?
Well, the question is about nonpartisan elections. I think that's discussion we'll have over the next several years. I imagine nonpartisan elections in the state, nonpartisan elections in the country, and nonpartisan elections in our community. I mean, injecting them now 50 days before an election is just a political conversation.
And finally, I guess going along with that theme, several times during his acceptance of the nomination, he referred to you in a negative manner as Sleepy Sam, sort of like the Attorney General refers to the heiress Valentine. Is this something that is just a page out of the Trump and Republican playbook, or is this something we're going to see throughout this campaign? Is it going to devolve? Any early feelings you have about things like that?
Well, I guess the question is about, you know, sort of Trumpian insulting language that has been deployed in the past few days. I think some of that is perhaps to establish credibility in the Republican Party, because that, you know, I think we see that across the country, see people try to act like the former president to be credible in certain circles in our community. I think my opponent's going to have a tough time appealing to everyone on all aspects of the community and all political factions. I think at some point you have to stand for something, be for something, explain why you're for what you're for, and move forward. I think it's going to be hard to be everything to everybody, but I think we see a lot of that, you know, Trumpian-like sort of confrontation or you know, the mannerisms, you know, that we've seen over the past 4 or 5 years for folks that are emulating the former president and trying to earn credibility among his followers.
And finally, does this just come down to a turnout battle between North County and South County? Or do you see it?
No, this election, like all elections, will be a referendum on my record as county executive, on the things we've accomplished in crime and public safety, public health, workforce development, all the issues that we've worked on over the past year. This election in the end is about whether or not folks believe that the county is going in the right direction, and they believe that my style and approach to solving complex problems is the right one. All the other arguments are all you know, political chatter, and I expect we'll hear a lot of that over the next 7 or 8 weeks.
Thank you.
Yep.
Thanks, everybody.
Thanks.